reviewing the Committee on Human Services Tuesday, March 16, 3 p.m. calendar. This meeting, including the audio and video of remote participants, is being streamed live on YouTube. You will find links to viewing options for all Senate meetings on the live and on-demand video page of the legislature's website. The Zoom meeting and YouTube live stream event will include the following agendas, which is the Tuesday, March 16, 3 p.m. agenda. In the unlikely event that we have to abruptly end this meeting due to major technical difficulties, the committee will reconvene to discuss any outstanding business at 3 p.m. Thursday, March 18th, room 225, and a public notice will be posted on the legislators' websites. For the people participating remotely, all testifier audio will be muted and video disabled until shortly before it is your turn to testify. We have a number of bills, and especially for a resolution regarding care homes, we will be limiting the testimony to 2 minutes per testifier. Okay, I will be reading a list of people who submitted written testimony for each measure. We apologize if the closed captioning doesn't accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You will find a link on the status page for the measure. So today, on Tuesday, March 16th, for this hearing, we have Vice Chair Leslie Hara with myself, Chair Joy San Buenaventura, and on Zoom we have Senator Bennett Misalucha and Senator Laura Ocasio. Okay. So, nothing else that I'm required to read. First up, HB 175, HD1, relating to sex trafficking. Amend Section 712, 1202 Hawaii Revised Statutes to include coercion as a means of committing the offense of sex trafficking. First up, we have for Farshad Talebi, the Deputy AG, testifying for Attorney General in support. Are you present? Okay.
I'm present, Chair.
Okay, please proceed.
Aloha, Chair San Buenaventura and members of the committee, Deputy Attorney General Farshad Talebi, and I'm the State Human Trafficking Coordinator. The department stands on our written testimony in support, and I'm available for any questions. Thank you.
Okay, thank you very much. Next up, Tricia Nakamatsu, Deputy Prosecuting Attorney of Honolulu, in support. Tricia, go ahead.
Good afternoon, Chair, Vice Chair, members of the committee, Deputy Prosecutor Tricia Nakamatsu. On behalf of the Honolulu Prosecuting Attorney's Department, thank you so much, Chair, for hearing the bill. We are in strong support of this as it is part of our 2021 legislative package. We would note that the contents of our bill are basically encompassed in a later bill that you're hearing today, HB 887. So we're also in support of that bill as well, if that were to move forward as the vehicle for this amendment. If you do choose to keep our bill moving, we would note that our bill contains a definition of coercion that, while it is consistent with the federal definition, it perhaps is a little bit too narrow, a little too restrictive. We would recommend that you take the definition out, and that would be page 1, line 15 through page 295.
Okay.
Only because if you read our testimony, one of the most common examples that's not already, we have been told by at least one judge, is not currently covered under statutes, is when a sex trafficking victim is told they're not allowed to eat or sleep until they bring in a certain amount of money that night. If you read that example along with our definition, it actually doesn't seem to fit in with the definition. So we feel a little bit broader, just a regular layman's or dictionary version of coercion would suffice rather than putting in our own definition.
Okay.
We're available for questions. Thank you.
Thank you, Tricia. Okay, no one else having registered to testify remotely, Those who have provided written testimony is Lee Hayakawa, Office of the Public Defender in opposition, Chris Cofield, Imua Alliance in support, Dara Carlin in support, Samantha Yee in support, Tim Hitchens in support. Anyone else wishing to testify on HB 175? Okay, seeing none. Questions, committee members? Okay, seeing none, we're moving on. Okay, first, HB 282, HD1. Emergency shelter minors, expands the circumstances where minor may consent to no-cost emergency shelter and related services to include cases where the provider is coordinating with child welfare services. First up, Governor's Coordinator on Homelessness, Scott Morishige.
Good afternoon.
In support. Comments, sorry.
Scott Morishige, Governor's Coordinator on Homelessness. I submitted testimony with written comments and suggesting some amendments. I just wanted to note that my office has been convening meetings between child welfare services and youth service and homeless providers regarding this issue of expanding access for unaccompanied minors to shelter. Through those discussions, we determined that the current definition of provider in statute is very limiting and only applies to providers that are licensed either as a child caring institution or a child pacing organization. So based on the discussions that we've had with both providers and CWS and after consultation with the Attorney General's office, I'm proposing some amendments that would temporarily expand the definition of provider with conditions until June 30, 2023. These amendments would broaden the current definition and also allow Department of Human Services time to evaluate the impact of the expanded definition, to give them time to make longer-term changes in the administrative rules. So again, this is a result of discussion with all stakeholders involved. Thank you for the opportunity to testify, and I'm available for any questions. Thank you.
Okay, thank you very much. Next up, Daisy Hartsfield for Department of Human Services, SSD. In support, comments? Is
Aloha,
anyone
Chair.
from DHS? Okay, please proceed.
Aloha, Chair, Vice Chair, and members of the committee. I am Daisy Hartsfield, the Social Services Division Administrator, and I am testifying on behalf of the Department of Human Services today. We did provide a written testimony. We support the intent of the bill as well as provided comments. I echo what was shared by the Governor's Coordinator of Homelessness. Regardless of what occurs in this bill, we will move forward with trying to improve and amend the administrative rules so that we can better serve this specific population, and I will be available to answer any questions. Mahalo.
Okay, thank you very much. Next up, Michael Galoya Jr. for LGBT Caucus of the Democratic Party of Hawaii in support. Please proceed.
Aloha. Michael Galoya on behalf of the LGBT Caucus of the Democratic Party of Hawaii. We stand in full support of the bill. I'm glad to finally hear that DHS and the Governor's Office is actually having meetings about our homeless youth. They've been sorely neglected over the years. I do have grave concerns over some of their suggested amendments. Limited it to 5 per, where we receive back on the continent where they allow a lot more, because we have almost 125 minors that sleep on the streets of Honolulu and just for the city and county of Honolulu. That does not I don't have the data for our neighbor islands, unfortunately. So we definitely need to have something done. There definitely needs to be, they need to be doing more. And we've been bringing this to the attention of DHS as well as the Governor's Office for years. So for all of a sudden, I'm glad to see they're actually doing something, but we need our homeless youth cannot wait another 2 to 3 years for them to actually do something to make sure that they have, DHS is making sure that our homeless youth shelters are available out there. So on that note, I thank you, and I'll be available for questions. Mahalo.
Okay, thank you very much. Okay, next up, Carla Hauser for RISE, Residential Youth Services and Empowerment in support.
Aloha, Chair, and members of the Committee on Human Services. Mahalo for this opportunity. I too stand in support of this and am in agreement with the Governor's Coordinator on Homelessness Amendment. And I appreciate the work that he and DHS have done to get us to this point. It is not perfect, but I do have confidence that we are moving in the right direction. So I too will be available for comment.
Okay, thank you very much. Okay, nobody else having registered to be on remote testimony, but those providing written testimony are HMS Child Welfare Services, Department of Human Services with comments, Judith Clark, Hawaii Youth Services Network in support, Laura Thielen for Partners in Care in support, Michael Galoya Sr. for Rainbow Family 808 in support, Pride at Work Hawaii in support, Nikos Leverens for HARM, Hawaii Health and Harm Reduction Center in support, AFL-CIO in support, Betty Lou Larson for Catholic Charities in support, Kaikea Blakemore for Neighborhood Place of Puna in support, Lynn Robinson Onderko in support, Eileen McKee in support, and Ian Ross in support. Anybody else wishing to testify on HB 282? Okay, seeing none. Members, any questions? Okay, seeing none, moving on. Okay, HB 722, relating to human trafficking. Establishes a statewide program overseen by the Department of the Attorney General to provide services and assistance to commercially sexually exploited children and victims of human trafficking. Requires the Attorney General to submit annual reports to the legislature. Requires the Children's Justice Program to coordinate the investigation and case management of child human trafficking cases. Includes cases involving the commercial sexual exploitation of children. And this is part of the governor's package. Okay, well, it says none. It's not part of the governor's package. I thought it was. Okay, first up, testifying for judiciary, Jasmine Mao Mukai in support.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Jasmine Mao Mukai. I'm the Director of the Children's Justice Centers. On behalf of the judiciary, we stand on our written testimony in strong support of HB 722 HD1. Thank you.
Okay, thank you. Next up, Director of Human Services, Department of Human Services in support.
Aloha, Chair. Again, it's Daisy Hartsfield on behalf of the Department of Human Services. Greetings as well to Vice Chair and committee members. The department did submit written testimony and stands by its written testimony, and I'll be available for any questions. Mahalo.
Okay, thank you very much. Next up, Lynn Araki Reagan, Department of Transportation in support.
Thank you, Chair. David Rogers with the Department of Transportation. We are a partner in human trafficking, and we stand on our testimony in strong support. Thank you, Chair.
Okay, next up, Hawaii State Department of Health and support. Are you there?
Yes.
Okay.
Good afternoon, Chair, Vice Chair, and committee members. I'm Scott Shimabukuro with the Department of Health, the Child and Adolescent Mental Health Division. We stand in strong support with the recommendation. As someone who has been involved on the CSEC Steering Committee and other related efforts, I have learned that our state has many knowledgeable and dedicated people putting their hearts and minds towards addressing this serious and considerable problem. I believe all the various efforts in the state are paddling in the same direction. And I also believe that having an appointed statewide coordinator would help us to organize and prioritize and synchronize that pattern. We recommend putting the statewide coordinator position back into the bill as was originally proposed. Thank you for your time and consideration.
Okay. Next up, I see Farshad Talebi, Deputy AG for testifying for the Attorney General in support.
Thank you again, Chair and members of the committee, Deputy Attorney General Fashad Tlaib, State Human Trafficking Coordinator, we do stand in strong support. Similar to the prior testimony, we are respectfully asking the committee to consider amending it back to the original form, which also included the statewide coordinator position. We're not asking for appropriations, but we do believe that having that explicitly in the statute would help us obtain federal grants and continue to fund and build the program. So thank you for your consideration. I'm available for any questions.
Okay, thank you very much. Okay, nobody else having registered to testify remotely for this measure HB 722. Those having provided written testimony are Office of Hawaiian Affairs in support, Maui Police Department in support, County of Hawaii Office of the Prosecuting Attorney Alan Bartolome in support, Honolulu Police Philip Johnson in support, Tricia Nakamatsu, Deputy Prosecuting Attorney, City and County of Honolulu, in support. Chris Cofield, Immoral Alliance, with comments. Alex Licton, Chair of the Legislative Committee of Hawaii Psychological Association, in support. Shirley David for St. Michael the Archangel Parish, in support. Melody Stone, Hawaii Island SafeNet, Hawaii Island Coalition Against Human Trafficking, in support. Cindy Shimomi Saito, Sex Abuse Treatment Center, in support. Dara Carlin, in support. Kevin Costello, in support. Brant Cam, in support. Cheryl B, in support. Karen Radius, that's former Judge Radius, in support. Anybody else testifying for HB 722? Okay, seeing none. Questions, committee members? Okay, seeing none. I have a question of the Deputy AG. So the House version, HD1, removed the statewide coordinator, and you testified that it doesn't require an appropriation. The question I have is it in the Attorney General's budget to have the statewide coordinator?
Thank you, Chair. The Attorney General has hired me in that position, so the position does exist, and we are, because it's a priority for General Connors, going to build the program. But again, I think it is very valuable to have it codified for the longevity and to be able to apply to grants and point to specific statute.
Okay, so you're assuming that because you were hired that it's already in the Attorney General's budget? Because that's the only thing I could see as to why the Human Services Chair removed that portion on the budget. Okay. Okay, well, I'll take your word for it since you're there and you're representing them. Any other questions?
Paid. Thank you.
Okay, moving on. HB 887, relating to crime. This is part of the governor's package. Creates a separate offense for those who provide anything of value to engage in sexual conduct with another. Adds sex trafficking to offenses that can be prosecuted at any time. Makes a person strictly liable for sex trafficking of a minor in terms of the victim's age. Changes the name of the crime of solicitation of a minor for prosecution to commercial sexual exploitation of a minor. Increases the grade of offense to Class B felony. Adds anything of value as a type of compensation for purposes of engaging in commercial sexual exploitation. Okay, first up, Fashad Tlaib, Department Attorney General, testifying for the Attorney General in support. I think this is your bill. Proceed.
Correct. Thank you, Chair and members of the committee. Deputy Attorney General Fashad Tlaib, and I'm the State Human Trafficking Coordinator. We stand on our written testimony in strong support, and I'm available for any questions.
Okay, thank you very much. Next up, I see Kara Jabola Carolis for Hawaii State Commission on the Status of Women in support.
Chair, we'll stand on our written testimony. Thank you.
Okay, thank you very much. Next, I see Darcia Forrester, Office of the Public Defender, in opposition.
Aloha, Chair San Buenaventura and members of the committee. Deputy Public Defender Darcia Forrester. The Office of the Public Defender opposes this measure for several specific reasons, as we discussed in our written testimony. I'd like to highlight that we strongly oppose the strict liability as to the state of mind and attendant circumstances that a victim was in fact a minor. Subjecting a person to a Class A felony with a punishment of a 20-year prison term should require some actual intent, knowledge, or recklessness as to the age of a person who purports to be an adult and who may even provide documentation like a fake ID to support their status as an adult when engaging in a transaction for sex. We feel that there should be a state of mind defense to an agreement made, especially if the agreement is made in an adults-only establishment like a bar or a dance club, where minors aren't supposed to be there anyways, where there's no reason to believe or intend to engage in a sexual encounter with a minor. Separately, in addition, we have very serious concerns about the broad language of the term any item of value, without some qualification that the intent is to participate in a business transaction for sex, as opposed to behavior that would be considered flirting, courting, or dating in the modern context. We live in a world where hookup culture is a real thing. Dating apps bring people together for sexual encounters, and we should not criminalize a consensual sexual encounter between adults because there was an agreement to have sex after something as innocuous as a meal or a beverage that is purchased or some token of affection is exchanged. Thank you. I'm available for questions. Mahalo.
Okay, thank you. Next up, Honolulu Police, Philip Johnson, in support.
Yes, thank you, Chair, for this opportunity. We'll stand on our written and answer any questions if you have any for us.
Okay, thank you very much. Okay, nobody else having provided requests to participate remotely, those providing written testimony are Maui Police Department, Victor Ramos in support, Gerald Enriquez, Maui County Department of the Prosecuting Attorney in support, Mark Tom, Department of the Prosecuting Attorney in support, Chris Cofield, Imua Alliance in support, Marcy Hamilton, Child USA in support, Jessica Munoz, Ho'ola Napua in support, Autumn Burris, Survivors for Solutions in support, Dara Carlin in support, Tamara Bitanga in support, Ashley Maha'a in support. Anybody else wishing to testify on HB 887? Seeing none. Questions?
Chair?
Okay, Senator Ocasio, please proceed.
I have a question for the police department, if available.
Yes, ma'am.
Thank you, officer. So this addresses page 4, line 17, section 6 that states, this section shall not apply to any member of the police department, the sheriff or law enforcement officer acting in the course and scope of duties during undercover operations. Under no circumstance shall sexual penetration or sadomasochistic abuse be considered to fall within the course of the scope of duties, which I absolutely agree with. But just to dive into this a little bit further, the question is, for example, would this exemption still allow police to receive, for example, a hand job from a sex trafficked minor?
Our policy would restrict that in the police department, but I don't think the statute would, ma'am.
So, okay.
Right.
Thank you. We'll address that then in decision making. Thank you.
Okay, thank you very much. Any other questions? Okay, seeing none, moving on. HB 975, relating to reports of child abuse, adds immunity from civil and criminal liability for individuals who provide information or assistance in child abuse investigations. First up, Human Services, Child Welfare Services in support. Daisy.
Aloha Chair, Vice Chair, and members of the committee. The department stands in strong support of this administrative measure. We submitted a written testimony, which I will stand by, but I wanted to emphasize two significant matters, and that has to do with the effective date. It has to be June 30th of this year, because that's a requirement that the federal government has imposed on us. Secondly, I wanted to emphasize that this immunity does not extend to reports or investigations done in bad faith. So individuals who report or assist in investigations that is made in bad faith would not be subject to what this bill is offering. So I just wanted to make that clear. I'll also be available for any questions. Mahalo.
Okay, thank you very much. Nobody else having registered to testify remotely. Those testifying in this measure are Alex Lichten, Chair of the Legislative Committee of Hawaii Psychological Association in support, Dara Carlin in opposition. Anybody else wishing to testify on HB 975? Seeing none. Questions? Okay, no questions. Okay, moving on. HB 980, HD1, relating to adult protective services, broadens the Department of Human Services right of entry into a vulnerable adult's premises to cover situations in which there is probable cause to believe a vulnerable adult is subject to any type of abuse, regardless of whether there is physical injury. This is part of the governor's package. First up, Human Services, for Department of Human Services, Adult Protective Branch, in support. I see Daisy.
Yes, aloha Chair. Daisy Hartsville, Social Services Division Administrator. On behalf of the department, our written testimony is in strong support of this administrative matter. The testimony is clear as to why this bill is necessary, and I'll be available for questioning, and also available is Lisa Amador, who is our Adult Protective Services Client Community Services Branch Administrator. Thank you.
Okay, thank you very much. Okay, yeah, Lisa Amador, Department of Human Services, Adult Protective Branch, in support. Okay, she's not present. Okay, no one else having registered to testify for HB 980. Those who are providing written testimony are Carolyn Carivao, Department of Health, Executive Office of Aging and Support, Gerald Enriquez, Maui County Deputy Prosecuting Attorney in support, Mike Goodman, Attorney at Law in support, Audrey Suga Nakagawa, AARP in support, Lynn Murakami Akatsuka in support, James Mariano in support. Anybody else wishing to testify on HB 980? Okay, seeing none. Questions, members? Okay, seeing none, we're moving on. Next up, resolutions. SCR 36, requesting the Governor's Coordinator on Homelessness to provide a status update on Kukui Ola Village and work with the Hawaii Interagency Council on Homelessness to further fund the Ka'alamaku shelter until the construction of Kukui Ola Village is completed. Okay, nobody having registered to testify, no written testimony, no questions that we can ask. So moving on, SR 25, same thing. Okay, moving on, SCR 41, urging the Department of Human Services to study the feasibility of increasing payment to Hawaii's Community Care Foster Family Home, CCFFH, and expanded adult residential care homes, that's EARCHs, for Medicaid recipients. First up, HMS MQD MedQuest testifying for Department of Human Services comments. I see Judy.
Hi, Aloha Chair. Good afternoon. I'm Judy Moore Peterson, MedQuest Administrator, and we stand on a written testimony providing comments. Thank you.
Okay, thank you. Next up, Jacob Moore in support.
Thank you, Chair, Vice Chair, and members of the committee. I'm a nurse practitioner on Oahu with over 20 years of providing primary care to homebound frail elderly. I work with the dedicated community care foster family home and adult residential care home providers. They work diligently 24/7 to care for our kapuna in the community since there are not enough beds in the nursing homes for these frail patients. They are truly doing angel's work for devil's wages. I strongly support SCR 41 to evaluate the Medicaid rate paid to these caregivers. Our current rate is below the equivalent service of California and is significantly below Hawaii's rate of $280 a day for the same patient in a nursing home. In order to continue to provide safe and quality care for this at-risk population, maintain an adequate supply of beds, and reduce the risk of pandemic spread by using smaller home environments, we must review this rate with the goal of increasing it in the near future. I also submitted written testimony and am available for any questions. Thank you.
Okay, thank you very much. Next up, Johanna Costa in support. Okay, I don't see her there. Next up, Maritas Anacleto in support. Okay, nobody else having registered to testify. Those providing written testimony are Maria Belinda Keli'iho Holokai, United Caregivers of Hawaii in support. Angelita Takahashi, United Caregivers of Hawaii in support. Maribel Tan, Adult Foster Home Care Association in support. Mary Beth Liano, United Caregivers of Hawaii in support. Marilo Farinas, CMC Ca Familia Adult Foster Home in support. Marfe Rotundo for CCFFH in support. Maria Corazon Cariaga, Big Island Adult Foster Home Operators in support. Marie Angeline Maluyo, Adult Foster Home Care Association of Hawaii in support. Josephine Ganacial, again, Big Island Adult Foster Care Home Operators in support. Elsie Javier in support. Marjorie Bumatai in support. Cynthia Gima in support. Grace Jadulang in support. Mary Rose Abadilla in support. Edgar Dulig in support. Charlene Arzaga in support. Jesse Villanueva in support. Belize Villanueva in support. Maricor Malivar in support. Sheila Purpose in support. Anybody else wishing to testify on SCR 41? Seeing none. Members, any questions? Okay, I have a question. Jacob Moore, are you there? Jacob?
Yes, I am.
So are you the president? And I see a lot of testimony, and I see that CCFRs are getting paid like only $41 per day. So it is substantially less than a regular person needs to be able to just survive. So I could see why we need this. But did you see a Department of Human Services testimony that says that if you want to have a rate increase, because the reality is this is also partly federal funded, they're going to require $500,000 to pay for what you want. I'm trying to find, do you know of any kind of funding sources, because the state doesn't have the money to pay for this?
Well, the original foster home program was set up under a Medicaid waiver program from the federal government. And it was, the original proposal of the demonstration project was so that that money could be paid to a non-nursing home for nursing home level of care. And the original plan was so that that could be up to two-thirds the cost of a nursing home. And currently the rate is 1/6 of the cost of a nursing home. So, I mean, that money is already being given to us by the federal government under the Medicaid waiver program. I didn't see the Department of Human Services comments.
Okay, so, Judy, are you still on?
I am, thank you.
Okay, so you heard the testimony. How come it went so far from being 2/3 of a nursing facility's payment to care for these individuals down to only $41 per day?
Yeah, thank you for that question. I don't know the entire history of, the rate increases or the lack of rate increases for the community care family foster homes. But as you noted in our testimony, that the rates are actually made up, or the payments that go to the CCFHs is made up of several different components. And the component that is the room and board portion of it, that is not a Medicaid payment. It cannot be a Medicaid payment. So unlike the nursing facilities, which does incorporate a room and board component, Medicaid at the federal level, and this is part of the federal rules, for home and community-based services like the community care foster homes, the Medicaid portion of it is only for the services themselves.
So they're supposed to charge the people with the room and board?
Or it comes from their Social Security disability income. Let me look up my testimony and make sure that I cite the correct source. Oh, oops, wrong one. Sorry about that.
Okay, so I'm going to ask Jacob, okay, while you're looking this up. So do you know that you're supposed to charge the people under your care room and board, because Medicaid will only pay, I guess, the medical portion?
Well, so the way it works is the Medicaid portion of the $41 a day is for the care. Many of the caregivers will get the SSA funds from the patient themselves, but again, these are patients who are significantly economically challenged.
Okay.
So it is a pittance, basically. And it basically goes to show that the rate needs to be studied so we can figure out how to make it better.
And I would just add also that there is a state-funded portion that the Social Services Division is currently operating. It's in a separate statute, and that amount has not changed in over 10 years. That is supposed to help cover the costs of the room and board.
Okay, so I have a separate resolution that I talked to Hawaii Healthcare Association of Hawaii on, and I haven't proposed this yet, so I want to know from both of you folks who are testifying whether or not you're in agreement with this. I know that the nursing facility has a sustainability fund. Is that something that can be looked at for community care homes facilities? I mean, would you folks be willing to be part of a working group to determine sources so that we don't have to come up with $500,000 to determine how to get more money to the CCFRs?
We would be happy to be a part of whatever working group for either the study or exploring ways in which we could come up with the state fund share that would be needed to increase the rates for whatever is determined. But were you referencing using nursing facility sustainability funds, or were you referencing coming up with another type of sustainability fund for?
Well, I'm exploring both, really, because I don't know whether or not the CCFRs have the money to tax themselves, like the sustainability funds, in order to get the federal matching funds. So, okay, so that's what I'm leaning towards. And any questions, members, based upon my questions? Okay, seeing none, I'll probably defer decision-making on this one to come up with an actual working group, because based upon my off-record discussion with Ha, and I think with you too, Judy, I may be wrong, and as well as Gary Simon to see whether or not they would be willing to do a working group on this. It sounds like we could come up with something. Okay, so I'll probably talk more until the next decision. Okay, thank you very much. So moving on. SCR 70. Requesting the Department of Human Services to convene a task force to plan the certification and training process for community health workers to help address the social determinants of poor health that disproportionately affect low-income minority populations. First up, Department of Human Services Director, comments.
I, Judy Moore Peterson, on behalf of the Department of Human Services and the Director Betts, stand on our written testimony offering comments. Thank you. I'm available for any questions.
Okay, thank you very much. Next up, Department of Health, Health Resources Administration, comments.
Thank you, Chair Bonaventura and members of the committee. I'm Lola Urban, representing Dr. Libby Char, Director of Health, and Department of Health offers comments and also wants to let you know that Department of Health has worked with many other state agencies and community organizations working with CHWs to help mature their role in serving their communities as part of the workforce development and improving care. We do want to note that this is a very diverse group in their educational attainment and employment type. And so we think that more time is needed for the overall group's readiness for certification, because we don't want to leave anyone out, since not everybody has achieved the educational attainment that a certification process may require. And they do provide a really valuable cultural navigation, as proven through what we're doing with the COVID-19 response. Thank you for the opportunity to provide testimony.
Okay, thank you very much. Okay, next up, Tammy Oyedamori Chun for University of Hawaii in support.
This is Tammy Chun from the University of Hawaii, representing Vice President Erica LaCroix. We provided testimony with comments, and similar to Department of Health, we wanted to point out that this is a pretty diverse group of individuals in terms of their level of training, as well as the kinds of occupations and work that they do. So that just needs to be taken into consideration in the process. Thank you. I'd be happy to answer any questions.
Okay, thank you very much. Okay, nobody else having registered to testify. Those providing written testimony are Eric Abe, Hawaii Primary Care Association in support, Dr. Adrian Dillard for Kula Nona Poe Hawaii o Papakolea, Kewalo, and Kalavahine in support, Jessica Yamauchi, Hawaii Public Health Institute in support, Kristlyn Gascon, Ka'u Rural Health Community Association in support, Jessany Marquez, Auntie Jessie, for Ka'u Rural Health Community Association in support, Station Sakuma, again Ka'u Rural Health Community in support, Teresa Richardson, Ka'u Rural Health Community Association, Richard Custodio in support, Tetine Centel in support, Daniel Maciao in support, Reza Salmo in support. Anybody else wishing to testify on SCR 70? Questions, members? Okay. I have a question. Tommy, Oyedamori Chun. Okay, I'm leaning, because nobody wants to head this task force, I'm leaning towards requesting the auditor to do a sunrise analysis directly on certification and licensing. Do you think that there's going to be a problem with that?
I don't believe that I would need to check. I'm sorry, I don't have a immediate response on that, but I'd be happy to get back.
So basically, I can ask the auditor when they do the sunrise analysis to be able to check with you as to what kind of different certifications are needed for a community health care worker. Okay?
Okay.
Okay, thank you very much. Any other questions, members? Okay, seeing none. Okay, moving on, SR 52, SCR 70 and SR 52. Oh, same thing. They're exactly the same thing. Okay, we have nothing further. Recess for decision making. Recalling the Committee on Human Services March 16 calendar for decision-making, 3 p.m. calendar. For HB 175, Chair's recommendation is to defer indefinitely because the language as testified to is already included in HB 887, and it requires major amendments. Any questions? Okay, seeing none, moving on. HB 282, Chair's recommendation is to insert an effective date of upon approval, accept the amendments proposed by the Governor's Coordinator of Homelessness, including an end date of June 30th, 2023, and any other minor tech amendments. Any questions? Seeing none, Vice Chair for the vote. Chair votes aye.
Members of the Human Services Committee, we're voting on the Chair's recommendation as stated to pass HB 282 with amendments. Chair Buenaventura.
Aye.
Vice Chair votes aye. Senator Ocasio.
Aye.
Senator Mitsa Lucha.
Aye.
Senator Favela.
Aye.
The recommendation is adopted.
Okay, so for, okay, thank you. So for HB 722 HD2, Chair's recommendation is to amend by reinserting the statewide coordinator per the Attorney General's testimony, add an effective date of January 1st, 2022, insert on the committee report that the statewide coordinator position has no appropriation request and is already in the Attorney General's budget. Any questions, comments? Seeing none, Vice Chair for the vote.
Members, you heard the Chair's recommendation to pass HB 722 with amendments. With all members present, any reservations or objections to the Chair's recommendation? Otherwise, I'll mark an aye vote for all members present.
Okay.
Recommendation is adopted.
Thank you very much. So for HB 887 HD1, Chair's recommendation is to accept the Hawaii State Commission Status of Women's Amendments. On page 14, subparagraph 2, keep the Class C felony except that an intentional or knowing violation of this statute is a Class B felony. Add on line 20, page 14, if such person had a reasonable opportunity to observe the victim as a qualifier to the strict liability portion, and otherwise add tech amendments. And in the committee report, we are going to add in Senator Ocasio's concerns regarding HPD policy on minors and human trafficking. And any other tech amendments as necessary. Any questions, comments? Seeing none, Vice Chair for the vote.
We're voting on the Chair's recommendation to pass HB 887 with amendments with all members present. Any reservations or objections? The recommendation is adopted.
Okay, for HB 975. Okay, this is the one that I needed to pass. Relating to reports of child abuse. Basically, Chair's recommendation is to add an effective date per the Department of Human Services testimony of June 30th, 2021, and other tech amendments as necessary. Any questions, comments? Seeing none, Vice Chair for the vote.
Members, we are voting on the Chair's recommendation to pass HB 975 with amendments. Any reservations or objections? Hearing none, the recommendation is adopted.
Okay, for HB 980 HD1, Chair's recommendation is to amend it by adding an effective date of upon approval. Any questions, comments? Seeing none, Vice Chair for the vote.
Okay, we're voting on the Chair's recommendation to pass HB 980 with amendments. Any reservations or objections? The recommendation is adopted.
Okay, for SCR 36, SR 25, Chair's recommendation is to amend with clarifying tech amendments. Any questions, comments, otherwise as is? Any questions, comments? Seeing none, Vice Chair for the vote.
This is SCR 36.
And SR 25.
And so, members, we're taking the vote on one vote for both resolutions, which is to pass SCR 36 and SR 25 with amendments. Any reservations or objections? Otherwise, the recommendation is adopted.
Okay, so for the remaining resolutions, we are going to defer decision-making until March 18th at 3:20 p.m. Okay, otherwise, thank you, folks. We're adjourned. Okay, done in 1 hour.